Left-sided cerebral hemisphere, frontal pole lies anteriorly, occipital pole lies posteriorly, and superolateral surface is convex and directed outwards. Lobe surface, superolateral surface, median surface, and inferior surface. Border, superomedial border, inferolateral border, and then inferior border. Inferior border. Inferior surface is divided into two. Inferior orbital surface, occipital surface.
Cantorial and cantorial.
That is the question. No. Central sulcus and central sulcus is the center. It divides central sulcus and lateral sulcus divides the frontal lobe. Frontal lobe and then parieto-occipital sulcus and para-occipital notch. An imaginary line joining these 2 points divides the occipital lobe.
Another line.
Lateral sulcus and joining the first imaginary line, second imaginary line we have to draw, and then it divides the temporal lobe. And then remaining, this is parietal lobe, anteriorly central sulcus, posteriorly imaginary line, first imaginary line, and laterally lateral sulcus and second imaginary line. This is parietal lobe. And then sulcus gyri in the superolateral surface. First central sulcus, precentral sulcus, post-central sulcus. Precentral gyri, post-central gyri. And in frontal lobe, superior and inferior frontal sulcus. And then superior, middle, inferior frontal gyri. In temporal, superior and inferior temporal sulcus, superior, middle, and inferior temporal gyri. Parietal, intraparietal sulcus, superior and inferior parietal lobe. And then occipital transverse sulcus divides into superior and inferior occipital gyri. And then here this temporal, here supramarginal gyrus and angulus gyrus. Supramarginal here, supramarginal and angular. Before supramarginal angular. It is not that much important. And then lateral sulcus, it divides into 3 ramus: anterior ascending, anterior horizontal, and then posterior. In this viscera it is not clear.
One lateral. Lateral or anterior. Anterior মধ্যে একটা ascending, একটা হচ্ছে horizontal.
Ascending, horizontal, and posterior ramus. 3 ramus. Then is median surface. In median surface, this is corpus callosum. Above the callosal sulcus. This sulcus is callosal sulcus. Callosal sulcus. And then above that gyri, cingulate gyri. And above that sulcus, cingulate sulcus. And then this lobe, median temporal frontal, median frontal lobe. And then center point, this central sulcus now. Here U-shaped lobule, paracentral lobule. Paracentral lobule, and this is precuneus, cuneus. And then this is calcarean sulcus. Calcarean sulcus. That's all in median surface. And inferior surface. Olfactory sulcus and H-shaped orbital sulcus. Olfactory sulcus here, gyrus rectus. That gyrus rectus. And then it is H-shaped, medial, lateral, anterior, posterior. Orbital gyri. Medial, lateral, anterior, posterior. And then parahippocampal gyri. This is parahippocampal gyri. Uncus. This U-shaped. This is uncus. Uncus. And then
Collateral.
This is rhinal sulcus, and then it divides it now. This is collateral sulcus, and then occipitotemporal. This is median occipitotemporal gyri, and then this is occipitotemporal sulcus. This is lateral occipitotemporal gyri.
এদিকে নাম্বার শো করছো
HF tail again. HF orbital sulcus no tail again.
Orbital. This is heart-shaped orbital sulcus. Anterior, posterior, medial, lateral orbital sulcus. Gyri.